The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. This is Elizabeth. I'm one of the organizers here, and I am just going to give everybody a few more moments. I know it is now 10 o'clock, but I want to make sure that everybody has time to get in because we have a lot of people on the call today. So we're just going to give them a few more moments, and then we'll get started. Thank you for your patience. We're really going to start momentarily. Okay, everyone, we're going to go ahead and get started here. I wanted to give everybody a couple more moments to get logged in. Okay, it looks like some people are not hearing any sound. Let's see, can somebody, let me go ahead and see what's going on here. Let me message, let's see. Okay. Okay, perfect. So it looks like we've got sound now. All right, awesome. Thank you, everybody who is sending a message stating that you can hear me. Perfect. So we're going to go ahead and get started. Like I said, we were trying to give a few more moments for a couple of the people to log in, but time is precious, so let's go ahead and get rolling here. My name is Elizabeth Sharia, and we're going to work today with my associate and partner, Sarah Wallace, to get started solving the Medicare puzzle for you. All right, so I'm not going to spend a lot of time on this. I'm just going to briefly mention that we are still here at AAA working towards making sure that our members can get appointments easily and safely. This is why we have the webinar. Actually, we have the opportunity to speak to you and not have to worry about any safety hazards. It's been quite some time now since the pandemic first started, and we're really working towards making sure that you can get the information that you need and also stay safe. So that's the first reason that we have this webinar. And the other reason is just to go ahead and make sure that our members can still get the information that you need. But I'm not going to spend a lot of time on that because you can obviously see what's going on there. So let's go ahead and move on. Okay, so I have so many people, every single appointment that I do, every single webinar that I do, asking me, what is the purpose of AAA? What's our role in making sure that we have Medicare for our members? Why is AAA doing this? What's the purpose? Well, AAA is here to help our members avoid, any pitfalls or obstacles with Medicare. We're here to make sure that you can understand what your needs are, how to navigate the confusing world of Medicare, how to figure out what your next steps are going to be, because no two people are going to have the same situation exactly. Everybody has different needs. Everybody has different time frames. If you're turning 65, everybody has a different set of circumstances that you need to get through in order to set up your Medicare. So that's where AAA comes in. And because of the pandemic, we have created a method that we use for our members to get the information they need. So we have a dedicated phone number for you to call, and for questions and appointments, our calls are recorded for accuracy and compliance. We have video conferencing available to you. We have digital signatures so you can stay home, stay safe, and get the information that you need. And we also have, we email you all of the documentation after the appointment, so you have everything that you need without ever leaving the safety of your home, the safety of and comfort of your home. And I'm sorry, I'm getting a little bit distracted because it looks like we're having a couple people who are struggling with audio, and my associate Sarah is trying to help you work through that. Again, please, if you have any troubles or any issues, please continue to send a message through, and one of the staff members will make sure to get that taken care of for you. Okay. All right, so what are we here to discuss today? What's our purpose? What's the number one thing that we're going to take care of for you? And my purpose today is to help you understand what the common Medicare potholes are. What are the common pitfalls? What can you know that you need to watch out for? And some of the common problems that people find are issues with understanding what their enrollment period is. Maybe somebody says to me, you know what, I'm 71, but I've been working all of this time, and I found out that maybe I'm going to be having a penalty when I sign up for Part B. Is that true? What's going to happen to me? I want you to understand when your clock is going to start and when you need to put your application in to avoid those penalties. Because it's not just Part B, it's also Part D has a penalty too. And as a matter of fact, just got off the phone before we started this webinar. I spoke to somebody who thinks that she might have one, and we were trying to work through that. So I'm going to be helping her understand later on today what she's going to need to do, what her penalty is going to look like, and if she's going to have one. Another pitfall is networks. I don't want to get into too much detail right off the bat, but as far as your networks go, something that I see quite often is people telling me, I've been researching a few Medicare Advantage plans, and it looks like the plan that I want, my doctors do accept. Okay, that's fantastic that your primary doctors accept that plan. The problem that we run into is the carrier website that you're looking at. When you're checking the network, it's not going to tell you what groups they aren't affiliated with unless you specifically search for that. So having the experience of a broker, of an agent who knows the carriers, who knows each one of the plans, is something that is highly beneficial. Because I worked with somebody this year who was moving off of a specific carrier because they found the situation where when they did the research on the network, their primary care doctors did accept the plan, but they found themselves in an emergency situation where they had to be hospitalized, they had to have surgeries, they had to have care from doctors that were not their primary doctors, and they found out that more than half of those doctors did not accept the plan that they had. It was an emergency situation, something they could not have accounted for, and they had to file claims and appeals and appeals and appeals to try to get those claims covered. So the network is something that you're going to run into, and you need the experience of a trained agent, an expert, or not an expert, but an experienced broker who knows those networks and knows what carriers would cover the situation that you think you might need. Another big issue is formularies. I have so many situations. I wish I could tell you about every single situation that I have found, because I've been doing this for so long. I have been doing this, to the point where I've seen so many different things, and your formulary is going to be something that you definitely need to speak to somebody experienced about, because it's going to be an issue. Whether or not you're on any prescriptions right now, or if you think you might be on any in the future, there's going to be situations that you're going to need to account for. And then we're also going to discuss the difference between Medicare Advantage and Medicare Supplement plans, because the type of plan you choose is extremely important, and there are big differences between the two of them. Medicare Advantage is also called Medicare Part C, and Medicare Supplement is also called Medigap. So at this point in the presentation, I am going to pause at the end of each slide and ask if there's any questions. Okay, and it looks like Peter has a question. What do you mean by formulary? Peter, the formulary is basically it's what prescription drugs each carrier covers, and no carrier covers every single medication that you might be taking. And I'll get into a lot more detail on that. Sarah might get into a lot more detail on that later on, but the formulary is basically what drugs the carrier covers. Okay, and I don't see any other questions, so we're going to go ahead and move on because we got a lot of ground to cover. Okay, so the first thing I'm going to talk about is enrollment periods. And because that's the first pothole that you find yourself in, your enrollment periods. So I'm going to assume at this point that everybody on this seminar is turning 65 this year, because this is a turning 65. This is a Medicare 101 seminar, and So usually I would, in in a past life when we weren't under a pandemic, I would be standing in front of you and talking to you, and I'd be able to do, show of hands, how many people are turning 65 this year. But since that's not the case, I'm going to make a Sherlock a deduction and say that if you're on this seminar, you're turning 65, or you're going into Medicare for the first time. Because somebody who's retiring would be going into Medicare for the first time, and it would be like you're turning 65. So under that assumption, I'm going to say you're here. You're in your initial enrollment period. You're in the open window when everything is available to you. You have the opportunity to set everything up perfectly. And this is the best time. And Peter, it looks like you're turning 65 next year. That's perfect. Because now you'll know, if you're on this and you're not turning 65 this year, you're a few years away, this information is still relevant to you, because now you'll know exactly when your clock is going to start, exactly when you need to get the ball rolling, and how much time you're going to have to do so. So you're in your 7-month window. All right, your 7-month window starts 3 months prior to your birth month. It includes your birth month, and then it runs for 3 months after. Okay, so that's the 7 months. And you have all the way up to the very last day of those 7 months to put your application in for Part B and pick your Medicare Advantage plan. Well, okay. So I'm gonna actually correct myself on that. If you put your application in for Part B on the very last day, you are going to get Part B and you're going to be able to avoid the penalty, but you're not going to be able to sign up for a Medicare Advantage plan. So please do not do it then. You always want to start your process at the very beginning, because if you're turning 65 in March, right now you're in your initial enrollment period. And if you're going to be retiring the same day, say your birthday is March 15th and you decided that you're going to retire March 1st, well, you're going to lose your employer coverage. In that instance, you want to make sure that you're signed up ahead of time so that your new Medicare Advantage or Medigap plan starts immediately. So you don't have that situation where you're without Medicare or medical coverage. You don't want to find yourself in a situation where you have to wait until 2022 to get any sort of coverage besides original Medicare. And we're going to go over the sort of risks you run being on just original Medicare. Okay, so this is your time frame. If you're just starting the process, you have a couple different options for signing up for Medicare, which I'm going to go over a little bit later, but this is your initial enrollment period, and it's 7 months, okay? And I don't see any questions about that, so let's move on. All right, so the next one is the annual enrollment period. What's the annual enrollment period? Well, actually, the technical name for it is annual election period, but it's more commonly known as the enrollment period. And we just got through it. I am sure you have seen the commercials that have been inundating every channel with Joe Namath telling you of all the different benefits that are going to be available to you. And Joe is correct on some things, but there's always circumstances around everything. But the annual enrollment period happens from October 15th and runs through December 7th. And that is the time when all of the Medicare Advantage plans change, okay? All of the plans are going to change a little bit. They're all going to add or change coverages. None of the plans can drop any coverages that original Medicare covers, but they can change how they cover that. So, for instance, we had some carriers who adjusted their inpatient hospital copay so that the benefit was, a couple $100s for days 1 through 5, and then you didn't pay anything after day 5. But there's no out-of-pocket maximum on that. So that benefit is per admission. So if you have multiple hospital stays during a year, you're going to continue to pay every single time. Some carriers changed that so that once you pay for day 5, you don't pay again for the rest of the year. So all of the carriers are going to make changes to their plans. So every annual enrollment period or annual election period, you need to take time and review your plan. See what changed on it. If nothing changed, if they didn't change the formulary to where now, you're, and this happens too, if they want to, or if they lose their contract with a drug manufacturer, they can stop covering a medication that you used to have coverage for. So every year we need to take a look and see what the plan is. And I see we have a question from Dan. If I'm currently on Medicare due to being on disability, do I need to do anything in regards to signing up, or am I already considered in? Dan, very, very good question. Thank you for asking. Now, to answer that question, I would probably need to get a little bit more information from you. So I definitely want to talk to you in more detail, because I need to ask a few more questions about that. But basically, if you are on Social Security disability for 24 months, then you automatically get Medicare Part B, because no matter your age, you're going to get Medicare Part B. And I should also add that if you're on Social Security and you're younger than 65, if you're 60 and you're on Social Security, when you turn 65, they're going to send you your Medicare Part B card. And they're going to say, it's going to come in a yellow envelope, and it's going to say, if you're not going to use this card, send it back. But otherwise, you're signed up for Medicare Part B. So Dan, in your situation, I would want to talk to you afterwards to make sure that I answer your situation correctly. But if you already have your red, white, and blue card because of your disability, then you don't need to do anything else. And you can actually pick a Medicare Advantage plan. But let's touch base afterwards and make sure your situation, okay? All right, and I don't see any other questions about the annual enrollment period, so let's go ahead and move on. Okay. So right now, actually, we are in what's called the Medicare Advantage Open Enrollment Period. It happens every year from January 1st to March 31st. It used to be called the disenrollment period. And what happens right now is anyone who has a Medicare Advantage plan, if you kind of feel like maybe it's not the right plan for you, or you have a new circumstance where you need something else, you have a chance, one opportunity to change your plan right now. It's unadvertised. You're not going to see any commercials specifically saying this. But right now, you can make a one-time change if you're already on a Medicare Advantage plan. The difference between this time frame and the annual enrollment period is it's only for people who have Medicare Advantage. Medigap people can't do anything. Medicare Part D people can make a change, but Medigap people can't do anything. The other big difference is the plans didn't change. The plans are exactly the same right now that they were when the annual enrollment period happened. It's just kind of a, I guess a get out of jail card, a get out of jail free card, because if you made a mistake, if you feel like you didn't do the right thing and you want to switch, or maybe you didn't do enough research and you find out that your plan isn't covering you the way that you want to, you can make a one-time change to something else. And I don't see any other questions, so I'm going to go ahead and move on. All right. So the next enrollment period is going to be called the special enrollment period. This period is a little bit more of a gray area. And the reason is because it's triggered by specific events. And what that means is, let me give you a for instance. Sally is turning 65, and she is going to be covered under her spouse's plan. And her spouse is 60. And so is she going to need to do anything? Well, no. If she wants to stay on her spouse's plan, she can wait as long as her spouse is going to be working. Once her spouse retires, she will need to pick up a different plan. So let's say Sally is now 71 and her spouse is going to be retiring, so she's going to be losing that plan. Guess what? She has a special enrollment period because now she's got a specific situation where it's been triggered by specific events. Her spouse is retiring. Now she needs to find a plan. Okay? And I'm going to just throw something in here right now. If you are covered under your spouse's plan and there's more than 20 employees on the plan, you do not have to do anything. You can remain on that plan past your 65th birthday without any penalty. As long as, and here is where my tone is going to change, and I want you all to sit up in your chairs and pay attention, all right? Because you are safe from that Part B penalty if you're covered under an employer plan, whether it's yours or your spouse, as long as your spouse or whoever is holding that employer plan is actively employed. If they are not actively employed, you now no longer have that exemption, that exception to the Part B penalty rule. So if your spouse is retiring, even if the employer plan says that you can stay on it, you still have to pick up Part B, because later on down the road, if you do not, and for some reason you lose that plan, you're going to have a penalty. All right? And I'll get into more detail on that in a little bit. Other than that, I don't see any more questions, so let's go ahead and move on.
Hey, Elizabeth, can you talk more about that woman who came into your office who was covered under her husband's plan, but unfortunately he passed away?
Yeah, so thank you so much, Sarah, for bringing that up, because so in my career, I've seen a lot of different things, and probably the most heartbreaking situation that I ever came across was I had a woman come into my office. She was 87 years old, and her husband had just passed away. Her husband was a retired state trooper. And when he retired at the age of 65, the plan said that she could remain on his coverage without any issues. So she did not sign up for Part B because she thought that she was exempt from that because she had credible coverage. Her husband passed away, and as a result, she lost coverage on his plan. I went down to Social Security to sign up for Part B and was told that her Part B premium was going to be more than $1,000 because she had gone 22 years without Part B coverage. And she was upset. She could not afford that, most people cannot, especially somebody, in her situation, she was just on, her pension, and it wasn't enough to cover her bills and her Part B premium. The problem was, the moment her husband retired, he was now no longer actively employed. And as such, her clock started the moment that he retired, because she did not do anything, and she was misinformed that she had, she did have coverage, but that active employment box was now no longer checked. So she didn't fit every single thing, and there was no way to avoid that. There was no way to change it. So if right now you are sitting there saying, gosh, well, what am I, I don't know if I'm going to check all the boxes. I don't know if I'm going to fit every situation to be exempt. What am I going to do? please take the time to sit down with Sarah or myself and find out what your situation is and if you are exempt. And if you are not, you need to understand what your options are and how to go about getting that set up. And thank you again, Sarah, for bringing that up. It was one of the most heartbreaking situations I've ever found myself in, and not one that I ever want to see anybody else not something that I ever want to see anybody else go through. So I'm always very, very passionate about making sure that everybody understands exactly what they need to do. And Linda has a question here. Suppose that you return to active employment for yourself. If that is the case, if you're going to be going back to work, if your employer offers coverage and you want to be under that coverage instead of Medicare, you can suspend your Medicare until you lose it again. And there's not going to be any issue with that. You would just need to contact Social Security and suspend your Medicare coverage. Okay, and I don't see any other questions. So, and we're running a little bit behind here, so I'm going to try to pick things up a little bit so Sarah has enough time to get into everything. So let's go ahead here. All right. So here is the most confusing slide that I have, because only with a government-run plan would A and B and D equal C. I don't know why it doesn't run linear, but it does not. So here we go. Here is what Medicare A, B, D, and C are. Medicare Part A is your hospital insurance. That's brick and mortar, that's room and board in the hospital. Doesn't cover anything else, okay? Medicare Part B covers everything else. Medicare Part B is your medical coverage. It's doctor service, outpatient services, diagnostics, preventative, durable medical equipment. Everything that is not an actual building falls under Medicare Part B, okay? Medicare Part D is your prescription drug coverage. Medicare Part D has a standard. Medicare Part D has a lot of numbers and rules involved. So, and we're going to get into a lot of detail about that. Sarah is going to walk you through the Part D standard. And Medicare A, B, and D are thrown together to form Medicare Part C, which is a Medicare Advantage plan. Now, a Medicare Part C, calling it that is a little bit of a misnomer, and I actually don't like calling it that, because it leaves you with the impression that Medicare Part C or a Medicare Advantage plan is another portion of Social Security that they offer you. And the simple fact of the matter is it's not. Medicare Part C is when A, B, and D are handed over to a private carrier, and the private carrier now gives you all three coverages in one plan. And that's the card, that's the carrier that you have, is your private carrier plan. And that's Medicare Advantage, that's Medicare Part C. They're different terms for the exact same thing. I don't see anything from anybody about this, so let's go ahead and move on. Okay, so we kind of already did it, but this is what your Medicare red, white, and blue card is going to look like. Okay, if you do not have this card, then you don't have Medicare, basically. And if you only see Part A on it, then you don't have Part B. Okay, but this is what your card is going to look like. And it looks like Salim has a question. Medigap policy, where does it land advantageous? Okay, so what I think you're asking is where does a Medigap plan fall? What does a Medigap plan cover? And that's a very, very good question. I'm going to get into that in just a couple moments. We're going to go through all of the differences, because a Medigap plan is very different from a Medicare Advantage plan in the way it operates and what it covers, everything. A Medigap plan is kind of like an additional coverage over your Medicare A and B. But we're going to get into that in just a couple moments. I don't want to ignore your question. It's just right around the corner. We're going to get into a lot of detail on that. I don't see another question, so let's go ahead and move on. Okay, So these are a lot of numbers. These are a lot of numbers. This is a lot of information. But basically, what this slide is telling you is that if you have original Medicare by itself, with no Advantage plan, with no gap plan, with nothing else helping you with your coverages, this is what you're going to have to pay. Okay? And the main thing I want you to focus in on is that Part B, if you look at that column, down at the bottom, it says leaves 20% coinsurance that you are responsible for. Okay, that 20%, that's a very ambiguous number. That's a very gray area, okay? That's 20%. Okay, 20% of $100 is not a big deal. Most people can manage that. But let's say you have a really bad year. You know, you have the worst year of your life. You have and something that I don't want to, you know, borrow any bad luck for anybody. I don't want to, you know, leave it. I don't want to scare anybody, but everybody knows your situation, your life can change in a moment. And let's say you have a horrible year. You're hospitalized multiple times. You have to have surgeries. You have to have, you have to have home health nursing care. You have to have a lot of different things to help get you back on your feet and better. That 20% could be 20% of $500,000. We all know that in the United States, medical costs could get extremely pricey very, very fast. So that 20%, if it's 20% of $500,000, guess what? Most people are going to see their life savings, all of their retirement completely wiped out in a moment. So that's what I want you to focus on. These numbers, you know, monthly premium is going to be $148 for most people. Yes. That's what you're going to pay in 2021. The yearly deductible for Part B is $203. You know, if you had to pay that deductible, probably one trip to your doctor you're gonna be at your deductible. Inpatient hospital, days 1 through 60, you're gonna pay $14.84. Okay. It's that 20% that I want you to pay attention to, because that is what you have to pay if you don't have any other medical coverage, if you don't have an Advantage plan, if you don't have a gap plan. That's what you're looking at. Okay. And I don't see any questions about this, so I'm going to go ahead and move on. Oh, well, actually, one thing I do want to point out is that you see there under Part A in the parentheses, it says lifetime reserve. What does that mean? Okay. That means that you have a set number of days that Medicare Part A is going to cover you for. And once you've used those days, they're gone. Okay? After day 91, you are going to be in your lifetime reserve numbers, and if you're hospitalized and you used up all of your lifetime reserve days, guess what? You don't have any more coverage. And I see Deb has a question. Is there a premium for Part A? No, Deb, there is not for 99% of people, okay? There's no, Part A is considered an entitlement, so there's no premium as long as you are a U.S. citizen and you or your spouse have been paying into Medicare for 10 or more years. If that's the situation for you, you have coverage, there's no premium. If that's not the situation, then you can still get Part A, but you might have to pay a premium and you'd have to check on that. Okay. I don't see any other questions, so let's go ahead and move on so we give Sarah enough time to get through what she needs to talk to you about. Okay, and here's where I'm going to introduce you to my wonderful, supportive, helpful, extremely excessively knowledgeable associate, Sarah Wallace. She is with us for And the Syracuse branch, so she kind of covers more central New York areas, but she's very knowledgeable in the Erie County plans in all of Western New York, Rochester. So she is my associate, my better half, and she is going to take you through the rest of this presentation. And feel free to continue to ask questions. Feel free to keep reaching out. And Sarah, what do you want to talk to us about?
So we're going to talk to you about how you can cover that 20% coinsurance that you're, kind of left on the table for. So that risk if you only have the original Medicare. Peter, you're asking a question, is there coverage available for after that lifetime reserve? We're kind of going to get into this a little bit. Getting either that Medicare supplement plan or the Medicare Advantage plan will cover some of the risks that we saw on this big scary slide, right? There's a lot of numbers on here. It's important to understand, but this isn't if you only have original Medicare and you don't have any other coverage. So you do have a path to take, and it's kind of tricky to decide which one's right for you, but it is an individual thing. Before we move forward, I want to make note everyone's on their own Medicare path, right? So you're not going to be on the same plan as your husband. You might have the same type of plan, but you're going to have your own Medicare A and B coverage. So it's important to understand your health journey is different from your spouse or your partner. So we're just going to go on a high-level overview of the differences between the Medigap and the Medicare Advantage plan. This is where, what's more advantageous? Well, it's really up to you and how you live your life and what your health journey looks like right now. So to consider a supplement plan, know that there's no networks for these. You have guaranteed renewability as long as you keep that premium paid. Everyone likes their bills paid. And your coverage and benefits never change. So it behaves more like that true insurance policy. Your plans are very comprehensive. You'll have a minimal or no out-of-pocket healthcare related expensive if you go this route. That usually means, that they're a little bit more month over month. As far as the Medicare Advantage plans, these plans must cover all of your medical and hospital services except hospice care, which is still usually covered by Part A. These are the plans that may have additional benefits. You might get some vision or dental routine services, some preventative services to keep you healthy. Hearing benefits are included, and more likely than not, they do have a gym membership add-on. These plans most closely resemble the health coverage you had while you were working. You will pay those out-of-pocket co-pays. The more significant a situation you have, the more likely you'll have a higher copay. So which one do you choose? This is an intimidating question to ask yourself, to really look at where you are health-wise, but a very quick comparison, very high level. A Medigap has zero to low out-of-pocket costs. Your coverage travels wherever Medicare is accepted. You might need a separate prescription coverage, so you'll have multiple plans to maneuver and stay on top of if you take the Medigap. And benefits never change. It's more like an insurance policy. A Medicare Advantage plan is by far the most popular in the central New York area. Typically, there's those lower monthly premiums, higher out-of-pocket costs when used. Your prescription drug programs are usually included with this type of coverage, but your coverage is accessible in regional networks only. So if you, don't travel very much, this might be the one for you. Sometimes extra benefits are offered, those preventative services for you. I see Peter has a question. If your situation changes year to year, can you switch back and forth? You do have that annual enrollment period to look over and change your plan. That's why the government created that for you, so you can make a change. Because your health doesn't stay the same year over year, so what you need one year will change to the next. That's a great question. Any other questions about?
I have a question.
Sure.
Can a husband and wife, or partner situation, can somebody be on a different type of plan as their partner or spouse? Can they be with a different carrier, or do they have to choose the same?
No, they will be on a different carrier. They might have the same plan if it's most advantageous for them, but really your health journey is your own. We're going to look at, what plan suits you as an individual instead of you as a couple. Good question. Elizabeth, Linda has a question I think that you would be able to answer. After the day, are the days for inpatient cumulative? Once you've reached the 90 days, are you in your lifetime reserve, or is that an annual number?
No, that's cumulative. Yeah. So good question, Linda. Let's if you want to talk about that further, and you want to actually kind of explore your different options for how to make sure that you don't find yourself in a situation where you don't have good coverage, definitely I'll reach out to you afterwards so we can go into a more in-depth conversation about that too. Okay, and it looks like Scott does have a question too about Medicare Advantage, Medigap. Let me go ahead and read the whole question. It looks like, okay, so underwriting. That's a very, very good question, Scott. And I want to make sure that everybody understands, because there's going to be a lot of information. People are going to say, oh, if you don't choose a Medigap plan right off the bat, you're not going to be able to get it later on down the road. Here's the thing. There are a very, very few number of states that have guaranteed issue on Medigap. And New York State happens to be one of them. So that means if you want a Medigap plan, all you have to do is pay the premium and you get a Medigap plan, because New York State is a guaranteed issue state. So Scott, if you want to enroll in a Medigap plan and you have your health is declining, you have a terrible situation, guess what? You're going to get that plan and you don't have to worry about passing a screening. Okay? The only time you might have to have any sort of waiting period is on any pre-existing conditions. There might be a waiting period if you haven't had coverage for more than 63 days, but you're still going to get the plan. So it's a very, very good question, Scott, and it's a really good option for people who aren't sure if a Medicare Advantage plan is going to be the best option for them, or if a Medigap plan is going to be the best option. Just understand that if you're a New York State resident, you have a Medigap option without worrying about underwriting. So very good question, Scott. Thank you for asking it. And I'm going to turn it back over to Sarah so she can get through, and hopefully we can get you all out of here by 10 o'clock.
We got great questions, though. That's always a good thing. So one thing I want to say before we move on this slide, one of the potholes, again, was your networks. If you have a doctor you really want to use, we can help see if they're in that network for you. We can find a plan that will cover them. I'm very loyal to my primary care. I've been seeing them literally since I was a child. I wouldn't want to change that. So that's something that's really important that we work really hard to kind of navigate you through so you can keep the coverage you expect with whatever plan you choose. Okay, moving forward, we're going to talk a little bit about that prescription drug coverage. And Peter, this is where the formularies come into play, where, what's covered where. I'm first going to talk about the different prescription tiers, just so you get an idea when anyone talks about tier 1 through 5 when it comes to prescription drugs, what that really means, right? So that tier 1 is your preferred generics. That's the cheapest type of medicine for the plan. You've got generics, preferred brands, and as it goes from 1 to 5, they get more expensive, right? Those dollar signs start to add up. And it's important to know where your drug lies on each formulary with each carrier, because in some it could be a tier 2, and in other plans it could be a 3 or a 4, and that does start to get expensive. So knowing what medications you're on and where they lie on the formulary is important to be able to save yourself some real money. Any questions on the tiering of the drugs? I know it's very general because each carrier has their own tiers, but it is usually 1 through 5, preferred to specialty. Okay, I don't see anything. We'll talk about the actual drug costs, right? And this is a big, scary slide. Those are big numbers on the slide there, right? $4,130. What does that even mean? So this is your drug standard. It starts again every year in January, so it's annual. It doesn't, accrue year over year. In the initial coverage period, you're going to pay the copays, and the plan pays the remaining costs until your total drug costs reach $4,130. So what you pay and what your plan pay both goes towards that $4,130. Once you hit this amount, you're going to find yourself in the coverage gap, where your responsibility increases to 25% of the cost for brand name and generic drugs. Between $4,130 and $6,550, you are responsible for that 25% of those drugs. Once you reach that $6,550, you're going to exit the gap, and then the costs will go down a little bit for you. For the rest of the calendar year, you'll pay $370 for generics and $920 for brand. Now, not everyone is going to reach catastrophic coverage or the donut hole, but it does happen more often than not. Elizabeth, can you go into maybe how the plan and copays go together to get you to the coverage gap, and why it's so important to understand where your drugs lie on each carrier's formulary?
Absolutely. So, here's where I want to go into a little bit more detail about drug formularies as quickly as possible. Probably the most extreme circumstance that I ever ran into was I was helping somebody with their plan, picking what type of Advantage plan they wanted to go into, because they knew that they wanted an Advantage plan, but they weren't kind of sure. And they were leaning towards this one carrier's plan. And when I started doing my research into their medications, because they were on a couple different ones, and most of them were tier 1, so it wasn't a big deal, but there was this one specific medication that was a brand name, and the carrier that they were looking at was, number one, they weren't going to cover it, and number two, they were going to cover it as a tier 5 specialty, okay, which means that they were going to have to pay 33%. And not only that, but the retail cost of what they were going to have to pay was $800 for that medication, okay? So what does that mean? Well, all of the carriers pay a different retail cost for the exact same medication because they all have different contracts with the drug manufacturers, all right? So when we were looking at this, they were going to be hitting that coverage gap pretty quickly, and they were actually not even going to get out of it, because then in the coverage gap they're paying 25% instead of the 33%. So now not only were they paying less, but they were going to hit the gap and they weren't going to get out. So then we took a look at another carrier, and that carrier was going to cover it as a tier 3, which is a brand name, which is still it was going to be there was going to be about a $40 copay. So that's the first thing. But then the other thing was the retail cost for the second carrier that we looked at. The retail cost was going to be $150. Why does that matter? When somebody is only looking at their copay, they're saying, my copay is $40. What matters is the retail cost was not going to get them to the coverage gap, because the retail cost is what they're looking at for that initial coverage phase for the 4130. So while their copay was going to be $40, which nobody wants to pay, the retail cost was going to keep them from hitting that coverage gap. And with one carrier, they were going to have to pay nearly $5,000 a year for their medications. With the other one, they were at, if memory serves me correct, they were somewhere around $900. So that is why the formularies are so important to take a look at and understand, and make sure that you're looking up the correct drug, because they all have different names. So Sarah, I'm going to turn it back to you so we can buzz right through this.
That's really intimidating to know that two plans that are very similar, one is going to get you to that responsibility of 25% of the costs for your brand name and generic drugs, and the other one, you're only going to have to pay your copay for the year. So it's really important to have the right prescriptions you take, the right dosage, and the time frame you take them. So we look into all of that for you. Any other questions about the prescription drug costs and Part D coverage? Great, I don't really see any. I do want to say, make sure you take the time to really think about where you are. Your health situation today may not be the same thing in the future. You all went through 2020 with me. You know exactly what I mean. That left a lot of people with very expensive bills because they did not understand their coverage. No crystal ball is going to tell you what changes in your health are in store. You don't want to think about being limited to an in-network if you're really, going through a health crisis. You want to get the best specialist. We're here to help you find the best access. What are the next steps here? So before we move forward, one thing that you've got to do on your own is see, when you are eligible for Medicare Part A and B. Elizabeth and I can help you find that out. And if you already are eligible, have that information ready for us. Mine and Elizabeth's information is right there on the screen for you. We both have direct lines. Those ring right to our desks. There's no touch through. There's no talking to anyone else. They go right to us. And our email addresses are there for you as well if you'd rather. If you don't want to write that down, I understand. I don't always have a pen available. You can put your phone number in a chat directly to us. We'll call you afterwards and, set up an appointment at your leisure. We really want to thank you for joining us today for this Medicare 101 coverage. You guys had some great questions. Please feel free to reach out to us.
Yes, thank you so much, everybody who was able to join us today. One thing I do want to say is everybody who had questions, especially the ones that had pretty extensive questions, Sarah or myself will reach out to you at some point either today or tomorrow to make sure that we get those things cleared up, because our job, our entire mission in life is to make sure that you feel comfortable, you feel knowledgeable, and you feel secure in your decisions, in your future, and in your health. That's all we care about. So we will be reaching out to you. You can reach out to us, like she said, as well. And we're going to go through this journey together, and we're going to make sure that everybody is taken care of and happy and healthy and knowledgeable.
Thank you all. Have a great day.
Yeah, thank you, everybody. You have a great day.